Michelle Wilson says she knows her father didn't have to die. There is cold comfort in today's urgent call that more vulnerable seniors shouldn't have to either.
Well, it's bittersweet. It's painful to know that this should have been done a long time ago.
Wilson's father was one of more than 50 residents who died of COVID-19 at just one long-term care home in Toronto. He's one of a devastated generation. Today's interim report by an independent commission looking at why was short and searing. The report to Ontario's Minister for Long-Term Care found chronic issues to blame, namely critical staffing shortages pre-COVID. The immediate recommendation so far, increasing the supply of personal support workers to ensure adequate care, and that a collaboration model should be mandated immediately where local health partners can help homes with infection control. Ontario's health minister says the province is already doing that.
If they're having situations where they're having an outbreak, if they're having infection protection and control issues or staffing issues, that hospitals can go in and help out.
But advocates say that's a stopgap measure and doesn't address the real issue, a shortage of skilled caregivers and the low pay that drives many away.
They just don't have the staffing available. So they need to put their money where their mouth is. They need to get the training, work with the colleges and get those things up and running right away.
Long-term care homes say better pay is on the table, but is only one piece of a complicated fix.
They need to feel safe, ensuring that the prioritization of the personal protective equipment, ensuring testing in long-term care homes, especially rapid testing.
My concern is it's been acknowledged before, but no action taken.
As for Wilson, she wants to see action too. It's too late for her father, she says, but not for others. Joanna Rumeliotis, CBC News, Toronto.
And David Common has been investigating the issue with long-term care closely. And David, the most urgent call here is around staffing. Can the system get enough staff in place in time?
No, not in the way they're talking about. There just isn't the supply that's out there. Doesn't mean there isn't stuff that can be done, but they're not going to get to the levels that this commission, that others have talked about. Let's talk about why. Minimum staffing ratios. They do not exist in Ontario long-term care homes, with one exception. You got to have one nurse in each home. So it could be one nurse for 99 residents. We've seen that before. We've also seen those frontline workers, the PSWs, one of them to 25 or 30 residents. That's kind of where you're at. Big problems with recruitment, also with retention. 18 months is the average turnover rate for many of those PSWs in long-term care homes. The Ontario government offering a $5,000 signing bonus if you stay 6 months. They're going to need to figure out something to keep people for longer than that, Ian, if we're going to be serious about tackling this long-time staffing problem.
Now, the other recommendation, cooperation with hospitals on infection control.
It worked before, it will work again. They probably need to be a little bit faster. PPE, not the problem this time. It's more about getting staff trained and getting enough of them. It's very high touch, very physical work inside long-term care homes. So the risk of transmission is higher. Just got to have more staff in there to be able to manage that risk.
Okay, David, thank you.